First of all, I'd like to thank the Western Trust and the Southern Trust for completing the programme. I don't think of it as last, but as a completion. It will be a major task, because this is the most ambitious IT implementation in Northern Ireland. We don't regard it as simply an IT implementation, we regard it as healthcare and social care transformation, which will enable professionals to deliver better care, but will also empower patients to be involved in their care. The uniqueness of this implementation is that it's going to cover almost 700,000 people over a very wide geography. We will have from Daisy Hill to Altmcgelvin. The implementation will involve all members of staff, it will involve all professions, and will empower patients and service users to receive better and different types of care.
I think looking at the banner, encompasses the future, is absolutely the right message, and that's what we've seen with the two trusts that have gone live. I think there's a big opportunity for the Southern and Western Trust to have even better go live than the previous one, and that's our aim, because we will learn with every go live how we can do things better, how we can improve services, and how we can learn from some of the key lessons in the previous implementation. So our aim, even though in terms of the implementation sequence, Southern and Western are the last trust in the implementation cycle, they should benefit hugely from all the work that done prior to them, and we should have a much safer and robust go live with huge benefits to everybody. We started seeing some of these benefits really earlier on, from efficiency gains, from experience of removing some of the duplications and paperwork, and I think more and more to come.
The uniqueness of this implementation is that it's two trusts working very closely together, but they won't be on their own. They'll be working with the local encompass teams in both trusts, the central encompass team and the Epic company who provide the platform. That collegiate working works well across Northern Ireland. You will have staff from every hospital and every community service across Northern Ireland here to help you with your go live, because what we're implementing is the same pathways for all patients across Northern Ireland, and hopefully the same outcomes. It's an exciting time. It is a challenge and it is additional work, and people do this on top of a very busy clinical and social care workload. We really do need to take time out and say, like, thanks for this. Transformation is not easy. We often hear people say we should transform the health service, but this is transformation in action, and it's delivered by those who care for the patients and care for their clients.
I think we are certainly very excited to get the last two trusts in the implementation cycle with a confirmed date for go live. I think the journey and the implementation, they are very complex and involves everybody. But what we've seen in terms of evidence, the more people are engaged and supported, the smoother the go live is, and the better and quicker benefits gets realized. And that's really what we're hoping, that, and the ramping up of engagement started at both trusts, and we need to see more of that, because it will pay dividend across the trust with this implementation.